We're going to start. Welcome, everybody. I am Lesley Stoyan. I am so happy to be here and to have all of you here. I think we are at 30 participants tonight, and I know there are some more coming in, so that's fantastic. This is our conversation about COVID and about my experience with having COVID and what I've learned in the last, I'm on day 89 today. So what I wanted to do was I actually had some questions while I was ill and had some people wanting to get some information about what it was like. I met some other people along the way who had experience like I did. I talked to some amazing people as I was learning about what it's like to be infected with COVID. And I thought, you know what? Why don't we just have an good old-fashioned educational forum, and we will have some candid conversations about COVID. So I'm so fortunate that I have some amazing friends, but also experts who can share their personal pandemic stories and points of view about what's going on either with them personally or within their career and within the world at large. So I'm going to officially kick us off now and say, welcome to my Corona Candid Conversations about COVID. I am your host, Lesley Stoyan. For those of you who don't know me, I am a Midtown resident here in Toronto, Ontario. I think we have a few people who are not even in Ontario tonight. And I am the founder of Daily Apple, which is a health and wellness education company, and a proud co-founder with my husband, Chris, of the Apple Tree Group. We do a lot of community events here in Midtown, farmers markets, and family-friendly programming. I am going to introduce you to our panel in just a second, but I thought before I did that, I would just go over a little bit of housekeeping. So with our group tonight of over 30, we are going to we are recording it because we have some other people that would like to be part of the conversation, but can't make it on time. So if you do not want to be seen, you should definitely cancel out press your stop video button. We are also going to ask that you are muted. If you forget to do that, that's okay. We have the power to do it for you. And we're getting pretty good at that. Lastly, we will be having a little bit of dialogue just between the panelists to start us off, and then we're going to open it up to Q&A. The Q&A, the chat function is open throughout the whole conversation, and you can send a message directly to Chris. He will be getting those questions going for you, and we will open it up at the end. Without further ado, I want to introduce my esteemed panel of guests and experts. As I said, I am also very fortunate that I have had both personal and professional friendships with all of these amazing humans. So first and foremost, I would like to introduce Josh Matlow. I'm sure many of you know who he is. He is a dear friend, but he is also our city councillor here in Ward 12. And he is the proud husband of Melissa, my other good friend, and father to Molly. So welcome, Josh. Joshna Maharaj is someone who both Chris and I have become friends with in our professional career. We met through our food activist work. She's a celebrity chef. You may hear her on CBC. I think she has some fans even in our panel tonight. She's an author of a terrific book called Take Back the Tray, and she's a local foods activist. So welcome, Joshna. Lesley Solomonian is also a Midtown resident. She is the most amazing naturopathic doctor, and she is an environmental, social, and human rights activist. Lesley protests like nobody I've ever seen before, and she does it beautifully and with kindness and compassion. So welcome, Lesley. Last but certainly not least, my friend Dr. Allison Calvin. She is a virologist. She's a vaccinologist. She's a professor of pediatrics and immunology. And she's also one of the lead researchers on the Canadian COVID-19 team. And Allison has just been an invaluable source of information for me, not just during COVID, but for the years, because as you guys all know, I am a total germphobe, and Allison is my go-to person for all things germ related. She's got the science, she's got the knowledge. And again, like Lesley, she delivers it with such kindness and compassion and empathy. So thank you for joining us, Allison. I also know you are exceptionally busy at this challenging time. All right, so we're going to kick things off with, I'm going to speak first. I'm going to take the first 5 minutes or so and talk about my corona. I just keep hearing that song in my head though every time and I am going to try to keep it a bit light. And I am known to get a bit emotional sometimes, but I promised myself that that wouldn't happen tonight. When we started to hear about this mysterious virus that was potentially coming to Canada, I was really nervous. As I said, I am a germphobe. I have OCD, and it's largely contamination based. But I have been preparing for stuff like this my whole life. I have been washing my hands and telling people, I'm sure much to their dismay, about how to properly wash their hands. I was the one that never let my kid go to indoor birthday parties between October and May because it is cold and flu season and you do not get in a ball pit. So I know how to do this. I know about germs and I know how to prevent myself from getting sick. I was terrified, but to be honest, I was pretty sure that it wasn't going to be me. Somehow there was a microscopic crack in my armor. I hadn't been anywhere, I hadn't seen anybody, I hadn't done anything, I hadn't even been to a grocery store. And I started to get unwell. I got unwell at the beginning of December with some mysterious illnesses, largely around gastritis and very intense lower back pain. We're still not 100% sure if that was the start of the infection. But I was diagnosed with a possible ulcer, hiatal hernia, medications didn't work, and I started dropping weight really rapidly. So the fear of cancer was on everybody's mind. I went on January 8th to Sunnybrook Hospital, and I can't even begin to tell you the terror in my body when I had to go into a hospital in the middle of, I believe, the second wave to have a minor investigative procedure. 12 hours after I got home, I spiked a fever. I got the most intense body aches and chills that I'd ever had. And that sent me into a virtual emergency room appointment at one of our local hospitals. Luckily, it was a virtual appointment. They assumed that this sounded like some sort of an infection that I'd contracted or some sort of complication from the procedure, but they suggested that I got a COVID test just to be safe. It didn't think it was likely going to be that route given, sort of my track record and where I'd been over the last couple of weeks. So I did. I got a test on January 10th, and I waited 12 excruciating hours, and I got the test results. No coronavirus detected. Woohoo! I partied. I was excited. I was so relieved. I was bawling. My husband crawled into bed with me and hugged me, and we were so relieved. But I still didn't feel well. I was starting to get significantly worse with my fever. So we assumed it was something to do with the procedure. Until the next day at noon, I got a phone call from Women's College Hospital where I'd been tested. And they said that there had been a processing error, a mass processing error at the lab, and that thousands of people had tested positive, but they didn't know it. And they were now calling and letting everybody know that there had been this batch error. I was in shock. I was terrified. I couldn't believe that this was possible. I was begging them, like, how couldn't this be an error? That like, maybe there's an error that I have this, like, can we test it again? Like, how could this happen to me? And I was assured that the likelihood was almost nil, that it would be a false positive. So we went into chaos mode. I was told that I immediately, for those of you who don't know me, and there's a lot, I think, on tonight, we're up to 34. We live in 897 square feet and there's 3 of us. So there ain't a lot of space. And I was told to immediately go into isolation. I was told to stay away from my 10-year-old son and to keep him protected and to keep my husband protected. We locked me in my room. We figured out how to keep the bathroom single use only and disinfect in between people. I was told that public health would be calling me within an hour to talk me off the ledge and give me the proper instructions of what to do. Josh and I are going to talk a little bit about that later, because public health called me 4 days after after the fact. The good news is we knew what to do. We disinfected every single surface. We hazmated suited up anytime I had to go into the shared washroom. There was more bleach, Lysol, hand sanitizer than you can possibly imagine. I have more alcohol in my body now than I ever did in university. The next couple of days were a blur of high fevers, body aches, heart palpitations, shortness of breath, extreme fatigue, sinus colds, symptoms, coughing, extreme coughing, vertigo, crushing headaches. But then they were interspersed with periods of bursts of energy and feeling like I was okay. And it was actually, maybe that was over. The best way I described the virus was it was like a dark creature that was lurking inside my body, and it would find little nooks and crannies and places to invade, and it would sit and wait and then move on to another part. I was able to distract myself during the daytime. I could look out the window, felt like one of the golden girls. I was able to watch Netflix. I think I crushed Bridgerton in a day. I had the absolute gift of having my dear sister Sydney and my father calling me pretty much around the clock. I connected with pretty much, actually, I'll get to this bit later, but one friend who gave me a lot of personal support over the first couple of days. So the days were okay. I managed my time. The nights were terrible. Even though I lived with 2 other people and they were a stone's throw away, I was still isolated in my room and with my thoughts. And I was terrified that I was going to die. I was terrified that tonight was going to be the night that I had to go to the hospital, that I was going to need to be intubated, and that I was not going to be coming out. And that would be the night that I said goodbye to my family on an iPad. I did my best to stay off the internet and not read stories, and I tried to stay as positive as I possibly could. I had a new gizmo, which I was quite lucky to have. I was hooked up to an oxygen meter, and I was able to monitor my own oxygen levels, which there was a golden number to watch out for. And thank goodness that was never, my fate was never determined by that wretched number. So I was very, very lucky to not get there. But the trauma and the isolation, it did take its toll on me. And I had to dig deep in my yoga instructor body and find all my mindfulness tools to ward off the panic. I had to try to stay positive, track my symptoms, and be really proactive about fighting this thing. I still track every day. I still track my symptoms. On day 11, I was allowed to leave isolation and go back with my family. And what a gift my living room felt like. It was unbelievable. But we still had to quarantine until day 15. And I'm not going to lie, it wasn't easy. We felt very isolated. We also felt very stigmatized. We knew we live in a condo, and we were worried about what people were thinking and how we were being judged. We knew that there was a bit of a sense that there were some people that were afraid of us. I'm on day 88 today. I still have symptoms. I've been diagnosed with post-COVID syndrome, or as they call long haul syndrome. And they vary from gastrointestinal issues to migraine-like headaches with an aura. Feel like I've taken some drugs, vertigo, brain fog. I couldn't draw a clock when I got tested. I couldn't believe I did not know how to draw a clock. Cognitive issues, crushing fatigue, and most recently, gum, mouth pain, hair loss coming out in clumps, and disruption to my sense of taste and smell. One day, everything smelled like dog poo. That was fabulous. But I decided something positive needed to come out of this. So 2 things I decided to do. I volunteered my body to research, and I'm part of the CanCov research program at UHN with the amazing Dr. Angela Chung. You might hear her on CBC quite regularly. And they're quite interested in my nearly 50-year-old fitness instructor body. So I'm happy to help, and I'm happy to learn about that and get as much information as we can. And I wanted to educate as many people as we could by having this candid conversation about COVID. So here we are. I've got amazing people to talk, and thank you for joining us. That's the end of my Corona story. We can get into questions if you'd like in the Q&A, but I want to introduce our first guest, Josh. So Josh, I'm going to sort of lead you into your 5 to 8 minutes, and you were the first person that I knew. You're going to see Josh in a bit of a different light tonight, because Josh, as you know, he's our counselor, he's a politician, you see him in that light, but he's also my friend. And on March 9th, when actually we were driving to visit my parents in Whitfield, Virginia, because we didn't want to get on a plane, I was a bit nervous about this thing that was maybe coming to Canada. Josh came into contact with the virus, and he was the first person we knew was forced into isolation. He had to go into his basement. He had to stay away from his family for 14 days. He had to try to manage his constituents and a community that was collapsing because of growing panic. And he had to do it all through this new platform called Zoom that no one had heard about. So Josh, welcome, and tell us, what was that like for you to be in that situation?
Thanks, Lesley. Hi, everybody. It was surreal. It was scary. It was surreal. It was it's kind of one of those situations in life where you're like, wow, like this is what reality has become. I think every one of us has been traumatized in our own ways, and every one of us have had that moment. But my moment actually began on March 5th of 2020. I I was on a site visit, as I often do in our community. And it was one of those days where I just had a whole bunch of different things going on. I was visiting a school. I was visiting, different constituents about different issues. And one of the visits was, and I remember this distinctly because I went to get a Jamaican patty in Little Jamaica, and then I walked over to Beth Shalom, and I remember scarfing down this patty. And I had a meeting with Rafi Aaron, some of you know, who's a great advocate in our city, and he has helped run an Out of the Cold program at that synagogue for many years. And I was visiting Rafi there to just take a picture. It was like just a few minute meeting to take a picture with him and then a representative from the synagogue with a piece of art that they were going to auction off in support of the Out of the Cold program, which supports vulnerable street-involved people who need our help. And so I just remember, scarfing down that patty and going inside and smiling and taking a photo with the art. And, I was going to let people know, like, please go to this auction to support this really worthy cause. And then I went and did a million other things. I went and visited a public school and chatted with a bunch of students. And I went to a whole bunch of different meetings. And then that weekend, I went to a convention with 3,000 people in a room. Yes, one of the last conventions we had in Toronto that year. And then, my meetings went on and on. The following Monday, I had my coffee in my hand. I walked into a committee room at City Hall, and I sat down, and the chair was about to start the meeting. And one of my members of my team texted me and said, "Josh, please come out of the hallway. I need to talk with you right now." I'm paraphrasing her, but that was the message. So I left my coffee and I walked out, and it was Diana. And I said, "Diana, what's going on? I've got to start this meeting." And she said, "We got a phone call from Rafi. That other person who you were with had just returned from Washington, D.C. and has been diagnosed testing positive with what we refer to at that time as the coronavirus." That was the moment that everything changed. One moment I'm living my life, which is already kind of weird. And then I was sort of thrust into this dystopian surreality. And remember, at that time, the world was still relatively normal. There were a few fist bumps going on, but people were still going to meetings and, movie theaters and the NBA was still on, all those things were happening. And I walked into my office. I called the medical officer of health, Eileen Davella. Remember, it was easy to do that at that time because there weren't that many cases in Toronto, hardly at all. It wasn't a thing yet, really, here to the extent, at least to what we understood. And she had to consult with her colleagues, and I sat in my office waiting to understand what this was. We knew that there was something concerning, something dramatic was happening in China. We were hearing various things happening in New York, almost like the beginning of one of those dystopian sci-fi movies where kind of this tidal wave is on its way, or you see the meteor in space kind of slowly approaching the Earth, but it just hadn't hit yet, at least here. And she called me back and she said, "Counselor, go home. Don't talk to anybody. Don't stop for anyone. If anyone tries to stop you in the hallway, excuse yourself. Don't speak with them. Keep walking. Go directly home and go into quarantine, self-isolate." So I went home. I called Melissa, my wife. I said, "I've got something to tell you." And for the next 2 weeks, as you said, I was living in isolation in my basement, unable to be with my family, unable to enjoy time with my daughter, who was 7 years old at the time. And not at that time, because I was in many, I think I was the first politician, definitely one of the more public facing people, the first public facing person a lot of people had known to have to go into this weird term called quarantine
Yeah.
or self-isolation. I didn't know what was about to happen to me. I was monitoring myself just like you described, not knowing if the next morning I was going to wake up with some horrible illness or not. I had no idea. And to this day, I still have no idea, frankly, if I had it or not.
Right.
But I definitely had the experience.
And you and I talked about one of the things about that too, Josh, is the stigma that went with it. So
Oh,
I mean, one of the things for when I was in Withville and I said, "Oh my God, I just got an email from Josh. He's in quarantine." I'm like, I think this is gonna get bad. Like I think we should turn around and go home. And Chris was like, "Oh, it's gonna be fine. Let's just get to Florida." And by the time we got to Florida, we did have to turn around and come home. But I remember thinking how chaotic and how crazy it must have been for you trying to manage because if I'd read about it, everybody had read about it, and what was the panic like in the community? And you're like, I'm in my basement. I'm like, like what's the CNN guy's name, Chris Cuomo or whatever, who was like, but you luckily weren't infected.
I don't know.
So thank God. But it must have been terrifying. And we talked about when you did come out, when you came out of your house, there was people were
Absolutely.
like, "Ah,
Yeah,
Josh."
and it's kind of in the context of the way I live my life, like because I'm so involved in our community, as you know, I live most of my days like, I go to the grocery store and, Melissa always teases me that I can't get out of there because people always want to talk and ask questions, and a lot of, hugs and handshakes when you go to different places and and as a politician, you want to be loved and liked by everybody. That's kind of in your DNA, and it's my nature. It's why I got
Oh,
into
you are, Josh. Don't worry.
Thank you. But the point is that it was especially really weird for me to go outside afterwards, and I noticed people cross the street away from me because they
Yeah,
thought that I was like the Elephant Man. They had no
yeah,
idea what I had,
yeah.
or if I had it. They were just scared, and understandably scared. But of course, you wear that stigma when people are confused about it.
Absolutely. Absolutely. And that's actually one of the things that I wanted to bring up. And, because I don't think people have thought about that. I remember we've had some personal conversations about that it does sort of deeply affect you. And it was, as I said, you were the first person I knew who was affected by the pandemic, not necessarily by the virus, but by the pandemic. Thankfully you were okay, but you had 14 days of trauma in isolation downstairs, even though there were people around. And I remember towards the end of your isolation, the video of Molly dancing at the top of the stairs. And
Kick the butt.
yeah, but that stigma of, when you did have to reintegrate. And I think this is going to lead to a larger conversation. And I thank you for your time. I know you have to go to another meeting and we're going to move along, but that we are going to bear that stigma, everybody, when we reintegrate, when we're able to do that. And I think that's going to have to lead to some bigger conversations about how do we do that compassionately and empathetically.
Lesley, before I jump to my next meeting, I do have to excuse myself, and I wish that I could stick around to hear all the other panelists.
Well, it's going to get fun.
I will see the recording and I'll make a point of it. But if I may just say, just with kind of 10 seconds, you know, I was really cognizant while I was in the basement that I had the privilege of actually having a basement and a bathroom, and I could self-isolate. I looked at my neighbors in apartments, many of whom didn't have balconies, and I wondered, like, if they had to go through this, what would they do? I think all of us are going to come out of this traumatized if we're honest with ourselves. Some people because they lost somebody, some people because they lost their business, some people because they couldn't hug their parents. Everyone's gone through something. And that's why what you're doing tonight is so important, because there's been so much emphasis on our physical well-being, but we have to take care of our emotional and mental well-being, and being together, even if it's remotely, is really important. So I just want to acknowledge what you and Chris and Luke do to make an effort to bring us together. And I really love you for that. I love you for a lot of reasons.
Thank you. I appreciate that, Josh. Same goes. And I know you have to get to another meeting. So if anybody does have specific questions for Josh, put them in the chat. Chris will mark them and we'll make sure that he gets them. So thank you. Best of luck with the next meeting.
See you soon.
Bye. And that's a perfect segue actually for Josh, because it's going to lead me into my next guest, which is who is Joshna. So Joshna, welcome again. And Joshna and I'd let you know we were connected way before in our professional careers. But the day I got diagnosed, several days after that, when I was very quiet about it because I didn't quite know what to do about it. And then I noticed that Joshna had put a post on her Instagram saying, dudes, I've got COVID and it sucks and I'm scared and what the hell. And I was like, oh my gosh. And she's noted her diagnosis date. And I'm like, we got diagnosed on the same day. And so I sent her a message and we've been consoling each other through the process. And we talked about doing this talk and getting some different information out there. And so thank you for doing this, Joshna. And I'm gonna sort of lead in with my question to you, although we could talk again for a whole conversation on your personal experience and your symptoms and everything else. But you also, not only did you find that you experienced a bit of that sort of COVID stigma, we talked a lot about what Josh was just talking about, which is the social inequality that coronavirus has created. I didn't get my call from public health for 4 days. I think you were possibly the same. And we talked about the fact that we both have connections. We know people. We have the ability to self-advocate. We're articulate. English is our first language. And I watched the apartment building across from my condo here. And I looked in and I thought, if public health didn't call a new Canadian who was living with, in a multi-generational 1-bedroom apartment, and there were 3 sick people and they didn't know what to do, somebody would just say, oh, you're coughing. I'm going to go to Shoppers Drug Mart and get you some cough medicine. And they wouldn't know that they were potentially supposed to contain. And how fortunate are we, and how is this happening? So that's sort of my lead in for you, Josh. And like, how did you manage this, both personally for you in isolation because you were alone, and professionally because you were a social activist?
Thanks for that. Hi, everyone. There's so much to say, but let me stick to the topic and stay focused here. But my personal diagnosis, I'm very, very grateful about the fact that my run-in with COVID was minimal. It could have been much, much worse than it was. So I'm grateful that I'm on this side of it mostly okay. But what I noted, the minute it started, I have pals, I am connected to traditional Chinese medicine. I have wonderful cooks and chefs, right? So so it was like a whole list of supplements to take. There were jars of bone broth left at my door, right? All of the things. I had the oximeter, all of it all came together. And what I really noted that was so fascinating to me was that all of my therapies, none of them included a trip to the drugstore. Right? That was super fascinating. I was like, all of these things that I have, including the really good food and the, you know, and the nutritional supplements. And then I got some herbs, and all of that came together. And I thought, this all came together because of people who I happen to know.
Right.
Right. And because of who I happen to be. And none of it was on any website anywhere.
Right.
Right. I got the email message. Women's College was the testing was incredibly efficient.
It was.
Right? I got tested at 5 p.m. By 8 a.m. the following morning, the email was in my inbox. But again, the email said that the novel coronavirus with all these numbers after it had been detected.
And just to,
right?
you did not get the call from Women's College that I got. So there was a bit of disparity there as well.
I
You didn't
get that call.
You weren't part of the COVID Care at Home program where you were monitored by doctors, whereas I was.
Not at all.
Right.
And then they were like, someone from public health is going to call you, so sit tight. And I thought to myself, and I was like, this is the way we're going to do this? I was like all sleepy in bed looking at my phone, being like, so I'm just going to wait. There's no follow-up email that's like, hey, chill out. It's going to be okay. If you have these symptoms, please go call 911. Otherwise, hang tight and see, you know what I mean? And someone will, and like, you know, rest or whatever else it is. And it was a good couple of days before public health called. Right. And I waited, and and the thing that I just found so insane was that they didn't just call. A nurse called to like prep me for the conversation with the doctor that was going to happen. And so it was like I was handed off to 3 different people, each of whom needed me to give them the same mouthful of information about myself. Right. Over and over again. Right. And I was like, is there a piece of paper? Didn't we go through this in Ontario about electronic file? Like, what is happening? Right? I wanted to be like, do you guys know that I'm sick? Right? Yeah. I'm not well. And you having me on the phone with this lunacy because your act is not together is not helping the situation.
Absolutely.
Right? It was so frustrating to me. And when they would, like, what I remember once when I asked what my symptoms were, and like you, Lesley, I had nighttime was really difficult for like 5 or 6 days. It
terrifying,
was panicky and horrible, and I was giving myself an elevated heart rate by worrying about whether or not I had an elevated heart rate. Right. It was madness. Right. Plus, you're like alone in bed. You're like, I have the thing that the whole world is afraid of getting.
Oh yeah.
You don't know what it's gonna do. Like, it was insane. Right. And so I told them about this. I said, nighttime anxiety is a really huge one, and I haven't heard anybody say anything about this. And that they picked up on. That they were like, oh, do you want to talk to somebody? And I was like, no, not at all. Not with this presentation of care and service. I'll handle this myself, right? It'll be fine. Open a bottle of wine and everything will be okay. Like, I was like, I'm okay. But to see that that's the thing that they hooked onto, not like, do you have a good source of food? Do you have, can you get, are there people to care for you? You live by yourself. What is your system? Do you live in an apartment, in a house? What? They didn't ask any of those questions. And
that was public health you're talking about.
Yeah.
Well, and I think we also connect on the fact that public health, this was something that, leads to this candid conversation about COVID, that public health both asked Joshna and myself to make the list of the people who we potentially and to call them. And I was like, you want me to call them?
Right.
I got a fever of like 106. I can't call anybody.
Seriously?
I can't even find the phone. Like, it was so, and that you can see how now, luckily I only had been 3 places, Sunnybrook Hospital, the blood lab, like I'd been nowhere. But you could see how also if you were in a situation where you had been really active, and perhaps you didn't have the language skills or the time or the inclination, that you would just say, pardon to be crass, but fuck it, I'm not going to call anybody. I'm just going to leave it. And then it keeps spreading further and further. I was ready. I paid attention because I was like, this is going to be the most important part of this. Yeah, to tell them.
For them to ask the questions about where I've been and who I've seen and whether I've communicated with people.
And they'll call for you.
Right. But there was none of that. And a template emailed to me of a letter that I could send to people who I've been in contact with.
Yeah.
right? And it like, and I don't know, this whole thing just had the like, because look, the other thing that grew from this was what I put it out there publicly, mostly because for efficiency, right? Because there are just too many people in my inbox and in the work relations and stuff because of who I am and what I do, that I was like, I don't have time for all those individual messages, right? I need to post and just tell everybody that I have this thing and go back to bed, right?
So it's a good, again, it's another good sort of segue from your story into the next one, Joshna. Where do you think, where can we improve on this? Like, so just your personal story aside, as a social activist, like what kind of processes could be put in place to make the process of getting sick and containing this virus from a society standpoint? We'll get to the science part later, but from a societal standpoint, what could we do you think?
Well, I mean, zooming outside of my personal experience to the broader experience, to the collective experience, what this pandemic illustrated to us was how threadbare our safety net is, right? It does not exist. And whatever is there is holes that everybody is sliding through. Yeah. And it is all of the things that we get dismissive about and we take for granted. We're like, it's not going to be a problem. You know what I mean? This is never going to be a thing, right? We all watched where $1 billion was pulled out of the public health budget, right? From the province, right? And you know that it was dismissive, like it's that someday funding that, you know, it's never going to happen. And then whammo, here we are.
Doug Ford didn't do that.
Right? And so to watch this happen and to watch people slide quickly into food insecurity is the most alarming thing for me, right? Because we don't, unfortunately, right, we don't have enough of a sense that when one thing hits a life like this, there's a domino impact and everything else will come crashing down, right? The minute jobs were halted and people were sent home, that loss of income took people directly to the door of a food bank. Yeah. Right. Those connections are very, very short. Yeah. And my friends at the stop are seeing, like, they're doing, usually, you know, lunch numbers hover around 200-ish. It's like 300 plus lunches they're doing every day, right? Meals every day just to keep up, right? And they cannot keep up with the demand, right?
Absolutely.
It's not working. And it's only going to get worse as every wave hits, as every school closure, you know, whatever it is. And so for us to really connect to the fact that we need a plan B, right? We need protocols. We need a system so that the minute the mayor or the premier calls a state of emergency, we all know exactly what to do, right? I think about this from the perspective of kitchens, because if so many restaurants were laid dormant because nobody was going in and eating in them, but what was happening in those kitchens? Those kitchens could easily be repurposed to start just feeding communities and sorting this out, right? We could know that we have a protocol that means the minute emergency is called, these guys over here are baking bread, these guys are making soups, you know, these folks are got muffins, and the lovely people at like Second Harvest or something is going to help to move it all around for us, right? This is what happened anyway, but wouldn't it be a lot nicer if it could happen with some structure and some resources, and not people who are watching their businesses hang off of a cliff also decide to make a few sandwiches and some bowls of soup? Like, God bless my colleagues, right? They all did this.
Yeah.
And wouldn't it be nicer if that wasn't just something you did because you felt like a jerk not to? You know, like, wouldn't it be nicer if there was more structure there? Anyhow,
I've got my pen and paper. I'm going to write, Dear Doug. I'm going to start right now.
We got some things to talk about.
We're going to get that piece moving. I think it's a perfect, and I hate to, Josh, and we could just talk all night. You're so passionate, and I hope this is generating some questions. I'm sure I see Chris like just fueling all the questions coming through. So I want to make sure we have lots of time for that. And thank you for this. I can also see like you and Lesley are just like from the same cloth.
I've seen a lot of nice nodding. Leslie. Thank you.
My two activists are just like, whoa, I'm on fire. So I'm gonna introduce Lesley now, and I'm gonna take Lesley's question on a similar path. We're gonna sort of, the theme is perfect because we've talked a lot about, Lesley's done work with Apple Tree for many years, and she's very passionate about addressing social inequality and addressing She does work with People's Pantry and making sure that she was getting meals out for the last year to people in food insecure situations. But Lesley also, I'm going to sort of go back even before the pandemic hit. Lesley has been one of the first true environmentalists that I have known since I've known her, and since, you know, I am an environmentalist, I guess, because of my passion for good food and healthy living, which just has a domino effect of being happy to the planet. But Lesley does everything right that I just aspire to. I'm in constant awe. And when I started thinking about the pandemic and how it has created what I'm sort of calling coronavirus casualties, there have been other things that have gone horrifically awry, not just as a result of getting sick, but because we've had to create these other problems. We were steps away, and my sister, who I think is on the call tonight, we were talking like about this today, just before the pandemic hit. Greta Thunberg was everywhere. We were all like, I can't have a plastic straw, like nothing, let's get rid of the plastic. And then boom, that was just over. And then disposable everything, like absolutely everything times a million. The plastic waste that has been created because of this pandemic and coronavirus. Lesley, jump on, like, where do we go from here? Like, how do we get back to focus? How do we navigate this pandemic and the horrible things that are happening in this pandemic, but also get back to thinking about what we were doing beforehand so that it doesn't get ultimately worse, just like what Joshna was saying with food insecurity.
Yeah, thanks, Lesley. I've been taking notes on some of the things that have been talked about already. And Lesley, you know that you and I can talk for hours on these things too. So we already established that you have the power of mute, because I can certainly spin off.
You got about 5 to 8 minutes.
Yeah, I'll be as concise as I can be. You know, I'm going to work backwards with my notes. So I am a naturopathic doctor, and what that means to me, and if you talk to different naturopathic doctors, you'll hear different things, but what that means to me is that I think in systems, I think in complex systems, I think in how one thing affects the health of the whole. And, you know, as a doctor for humans, that, you know, I think about that in terms of the body, but also the environmental and the social and the economic determinants of health. And very briefly, a little plug into, you know, what is our system doing wrong? Our public universal health system is not designed to optimize health. It was designed in the 60s to fund doctors and drugs, which it doesn't even do thoroughly, to really address infectious disease first and foremost, and traumatic causes of illness, like, you know, trauma, things that require surgery. It is not well designed. It was never designed to address preventative care. It was never designed to optimize health. And so as much as we talk and we take pride in our sort of Canadian universal health system, it doesn't do that. And there's lots and lots of problems. So I would say that, you know, given that social and environmental determinants of health make up, some estimates say, close to 60% of a person's health and well-being, our healthcare system doesn't address any of that. And so in terms of those big holes in the safety net that you're talking about, Joshna, that's a big part of it. Our health system is not designed for that. And so, I mean, that in my opinion is one of the first things that needs to be addressed. But of course, our health in this country is abysmal. And so we're constantly putting out fires, and there's no money left for those other things. I think 2.3% of the Ontario healthcare budget goes to public health initiatives. So that's why you were failed in terms of the public health response to your illness. So I just want to say that. I actually ran into Josh this morning. We're neighbors, and I was out working in my garden, and I have a garden in my front yard, and he wandered by and he said, "Oh yeah, we're going to talk tonight." And, you know, I was saying to him, I know what I want to say, but I've been, you know, one of the lucky ones in that I haven't been personally affected by COVID. You know, yes, I have friends who've been infected, but I haven't lost a loved one. My income hasn't changed. I can work from home. I'm a naturopathic doctor, but I'm more of an academic doctor. So I do a lot of writing and scholarship and teaching and learning. So I can do all of that from home. And so I was saying to Josh, like, I don't know, this isn't personal for me, but what I do feel is a lot of anger because of all of these things that we're talking about. And he said, you know, but that is personal for you. These are things you care about deeply. And sort of to come back to your point, Lesley, you know, I've been working my whole life, arguably in various ways, towards the end of ecological justice, which includes social justice, which includes justice across time and across space and across species. And this pandemic has utterly derailed those efforts. And, you know, I've continued to work away at it. But the thing that frustrates me the most is that our collective response to this, and I want to say too that COVID, and we all know this, but I'm just going to really state it clearly, that COVID hasn't created these problems. COVID has exposed these problems. COVID has shone a light on these problems. These problems of social inequity and vulnerability due to systemic, structural, by design marginalization of populations globally, locally, based on the construct of race and our economic system and all of those things, those inequities existed already. COVID has just shone the light on them in a big, big way and exacerbated it. Not only in terms of who it affects, like all of the examples you've all given in terms of who can self-isolate and who can work from home and all of those pieces, language barriers, et cetera, but also our collective response to it, right? So, you know, all of the small businesses that are being shut down, but Bezos is making billions, you know, like to me, not just the pandemic, but also our response to it are simply perpetuating the deeper problems. The other piece that I often feel angry about, and I'm just owning my anger right now, is that the way that our narratives, whether it's, you know, my son is big into the idea of propaganda. He's almost a grown up, so we can give him that kind of space. I know I don't look old enough to have a grown up son, but he's big into propaganda in terms of the media narratives that we're fed with respect to, you know, what is truth exactly. And you know, we're really told that the solution is to stay home and wash your hands, which is why you've all been so stigmatized, because we've put the responsibility of getting this disease, like every other disease, squarely on the shoulders of the individual. And it's not anybody's fault. It's the context, it's the circumstances. And so we're collectively stigmatizing people for getting sick through absolutely no fault of their own. And we know that most of the infections are not amongst kids who are partying. It's about people who have no choice but to work in food plants. That's who's getting sick. We saw that in the paper today. Yeah. And so we really have to think about that. And I guess the final piece I wanted to make really clear is that, again, as a naturopath, I tend to look at symptoms that a person experiences as just signs that something's off. It's a sign of imbalance. And COVID very much is a symptom of much deeper, much bigger global planetary problems. We can trace the emergence of COVID as a zoonotic from an animal to human disease directly back to our social and economic systems and you know, the loss of habitat for animals and like all sorts of connections are there. And so it's a very devastating, catastrophic symptom, but it is a symptom, and we're not going to solve it, nor will we prevent future pandemics by focusing solely on vaccine programs, as important as they are. I got my first dose on the weekend. I'm not saying it's not important, but it's not adequate. And so we have to think broadly. We have to think about the complexity of it, and we have to get really smart people working together across disciplines to solve it.
Well, isn't that so great that we have all these smart people on the panel tonight, and everybody has their own little niche? You know, I am the company cheerleader here, and we can do aerobics together and so forth. And we're going to bring in our virologist next. But Lesley, first of all, I want to touch on just couple things before we finish off with Alice, and then we open it up to everybody else for the last half hour. First of all, I want to be transparent in my personal pandemic points of view and also my Corona story. Lesley was the first person I told because of exactly that. And I might get misty now. I was really worried. I was really scared to tell people I had it. As we said, we live in a condo. I was worried about people judging me. I was worried about the stigma. I was worried that people were going to think I'd done something wrong. I'd broken a rule, and oh, you know, maybe Lesley, she preaches all the time about washing your hands. Maybe she's not quite so careful. And you were the person, because I knew you wouldn't judge me, and I knew you would be open-minded about it. And I didn't tell other than my family for days. And you were a wonderful source of comfort to me. So I thank you so much for that. I also want to leave you with potentially, you know, a brain buster, a stump the chump kind of, how can we, and this will be a good segue into Allison too, because Allison works directly in labs. can we come up with like some kind of like recyclable, compostable gloves and masks and hazmat suits and, you know, something to think about for the future of
well, yeah,
waste,
and I'll
plastic
tell you,
reduction and yeah.
For sure. And there are definitely companies that have rapidly, you know, they were doing it before, but have really rapidly scaled that up. It's very interesting because I'm actually in a battle right now with my place of work. So I teach at a teaching institution and medical clinic. And the recommendations or the requirement, the policy for PPE exceeds that the government has recommended. And I have worked hard to change that policy because there's no evidence to say that it improves safety. The strategies they want us to use have no evidence to say that it improves safety. It's all for optics. And I have been consistently refused in terms of that policy change. So I can't comply. I cannot do it. I cannot throw away gloves with every patient that I touch. And it's not necessary. And so I'm being told I can't work. And so, you know, you said I protest. This is my personal direct action. And to me, again, that's a really good example of what we're talking about is, you know, if we're willing to sacrifice, you know, the planet and, you know, the turtles in terms of the plastic waste, because we think it's going to give us this illusion of better safety when actually there's evidence to say it might make it worse if people still aren't washing their hands, then that's problematic. So my first point is like, maybe we should be really, really cautious about, you know, particularly amongst the public. There's lots of evidence to say that glove wearing by the public is not recommended for all sorts of reasons. And so I think we need to communicate good. And Allison, I'm excited for you to talk about some of those sort of evidence-based realities of this virus. But yeah, Lesley, obviously we need to implement systems not only to replace the products that are harmful, but also change the structures that result in us needing those products in the first place.
I have the perfect solution. I'm probably just never going to leave my house again. So I'll just live here in my 897 square feet with my good looking husband and my kid. And
good looking, but your plants are plastic and you need the real thing.
Anyway, thank you very much, Lesley. Again, we could go on for hours, and we may have to have a part 2 from this. But if anybody has questions for Lesley, you're welcome to put them in the chat, and we'll get to them in just a few moments. You know, last but not least, Allison, you know, you're my shining star over there. Allison and I have known each other for years. Allison and I had the pleasure. I used to be Allison's teacher. I used to teach her fitness. And Allison, I'm just going to embarrass you briefly for a moment. Allison was always it was new moms, and we were all had little kids, and I was the teacher, but we had a whole group, and we all became friends and worked out together every Wednesday night. And Allison, I didn't even know this, I don't think, until a couple of years into our friendship, that she was a virologist, and she was studying how to prevent the influenza virus through vaccines. And at the start of every, you know, cold and flu season, I would be like, oh my God, I'm terrified. Like, I have hand sanitizer, I have this, I'm a germphobe. Like, I've wiped down your mats, everything's pristine. And Allison would, you know, very quietly just say, like, guys, you got to take the flu seriously. Like, it is a serious illness. And she was so kind and lovely about it. And she taught me so much about disease and disease prevention. And I am a nerdy scientist wannabe. So Allison, I've seen you've been on so much news over the last year. You are working tirelessly on this thing. You have helped to develop the vaccines that we got rolled out so quickly. We are all hanging on this. Like, if we all get vaccinated, is this going to be over? Please. I welcome you to jump in and join in on the conversation. And like, how can we get this thing on track in your best science opinion?
Thanks so much, Lesley, for having me. And I totally miss cardio yoga.
I miss you too. You had the best high kicks in the whole class. Like,
oh yeah, I'm not as in shape anymore. And also I've really appreciated the stories and points of view of the other panelists. It's, I think, you know, really interesting to take in and like put it all together. And something that I think is really important is the concept of One Health. So I'll talk a little bit about that, but really like where I'm going to start is going through my story, which is my career, but it's also who I am, because a lot of who I am to my career. And people say don't do that, but I really believe I'm the best scientist when I'm a female scientist and a mother scientist. So really my experience with viruses started in 2003. So I had just finished my bachelor's of science, and I had a summer student position in one of the hospitals in downtown Toronto. And this coincided with the outbreak of SARS-1. And because I was a summer student, they asked all the summer students in the hospitals to participate in kind of the more social side of infection prevention. And that was helping to screen people as they were coming into the hospital, and not just patients, but workers. So actually I worked at a door where we would ask people, where have you been? I'd take their temperature, make sure they got hand sanitizer. So with that was a really interesting aspect and start to my scientific career. On the other side, the flip side of that is that not only was I working in that aspect as a summer student, but work that I did in the lab was analyzing patient samples. So samples from SARS-1 patients that were quite plentiful throughout the Toronto hospital network, and looking for markers of severe disease. And so I think everything that I learned there has interestingly been applied to what is going on now, but also the rest of my career. So after that, I went to Europe and I did a PhD and worked a little bit on infectious disease, but more of the molecular side of it. And then I went to Italy to do a postdoc, and I was working on the island of Sardinia, which is actually an island in the middle of the Mediterranean. And it functions almost as a land bridge between Europe and North Africa. And it sits right on one of the migratory bird flyways. So birds migrate north to south throughout the winter. So we had this idea that we were going to use wetlands on the island to start collecting bird samples to look for bird flu, because we felt that avian influenza was going to be the next pandemic virus. And so really at the heart of it, that's what I am. I'm a pandemic researcher interested in pandemic preparedness and this concept of One Health, that spillover events cause significant disease. Of course, this isn't every spillover event, but many of them some of them have caused great disasters, like the one that we're experiencing now. So I'm looking for avian influenza, thinking it's going to be the next pandemic virus. And I was able to find some types of avian influenza, but nothing that really looked like a pandemic virus. So as I'm writing up my research results and getting the paper ready, I go to take a break. I'm literally writing the report, and I look online, and there's a news report of a mysterious virus out of Mexico associated with swine. And that was the beginning of the 2009 swine flu pandemic, which we don't call it that, we call it 2009 H1N1 pandemic. And the spillover event most likely occurred in Mexico that caused this virus to spread in people were naive to this particular strain of influenza, and leading to this pandemic. And as the cases started adding up, we started looking at who was being severely affected. It was pregnant women, young children, older individuals, people who were overweight. And I was sitting there and I was about 4 months pregnant. So I'm a pandemic researcher researching influenza, and I'm also now one of the vulnerable populations. And I'm about 4 months pregnant. This is April. And we're, thinking about the vaccine rollout, and knowing that pandemics come in waves. And usually you have like a smaller first wave, a larger wave, which is usually the most deadly and biggest in the fall, winter following the first wave. So I was due October 2009, right when we were predicting the height of the second wave, which created a lot of anxiety for me. And knowing what was going on, I guess, pathogenically inside, what could have happened inside me being pregnant. And not only that, I had another young child who was less than 2 years old. So that was just a really interesting perspective, I think, and caused anxiety, but also I channeled that into really wanting to understand what that dynamic was between mothers and their children, and kind of the family unit, and how viruses transmit in the family unit, and why certain people become more susceptible to severe disease, hospitalization than others. So I kind of built my career after that, looking at why pregnant women, young children, and older people were more susceptible to severe disease after influenza. And one thing that I forgot to mention is the reason that we kind of switched to influenza is because the funding for SARS-1 was no longer there. We're talking about a 6-year gap, but no one cares about a pandemic or pandemic threats really when you're not in that pandemic. So influenza was kind of a good vehicle because the virus changes all the time. We have different strains becoming dominant. We have to redevelop the vaccine twice a year. So it was a good vehicle to study pandemics or emerging viruses. And then also I had interwoven into that the perspective of who was going to be most hit by emerging viruses or these changing viruses that I was studying, in particular flu.
So COVID is your Olympics, Allison. Is it?
So, yeah. So on the fast forward, I got to set up my own lab at Dalhousie University, and I set up probably the highest level of containment lab at the university, which is only a level 2+. So pathogens are rated 1 through 4. The 4 being the highest, most deadly. You probably won't survive. You don't want this to get out into the community. So that would be something like Ebola, SARS-2 and SARS-1, are 3. And so I'm sitting at like a 2+, almost a 3, but I don't have the infrastructure built into the buildings to really deal with these high containment viruses. So in my daily work, I wear like one of those spacesuits.
Spacesuits. You look good. You wear well.
So I'm trained to use the PPE, but I just didn't have the building. So this is, about 2018, and then 2019, December 30th, it was Christmas vacation. My family had come to visit me in Halifax. They had left probably the day before, so I'm fine. I'm like, yes, my family's gone. I'm relaxing. My husband and I had some glasses of wine, and then I go to bed. By this time, it's getting into New Year's Eve, early hours of the morning, and I check my email on my phone one last time. And I subscribe to something called ProMed Mail, which is I call it the social network for infectious disease researchers and doctors. And basically, they send out an email anytime there's a report of an outbreak of an infectious disease in plants or animals anywhere around the world. And so I like to say that because I get tons of these emails a day, but I'm always kind of casually looking for the respiratory virus, new respiratory virus that's causing a cluster of cases. And you know what? That's what was at the top of my inbox that evening. It was a notice out of Wuhan, China, that there was a cluster of about 20 to 30 cases of undiagnosed pneumonia. And immediately I was concerned, thinking about coronaviruses and influenza viruses. I sent it to some of my colleagues. So that's, for me, it was, again, December 30th, 31st. And going into January, the first week of January, I reached out to Vito Intervac, which is where I am today. And it's basically the only facility I knew in Canada that could deal with this virus in a capacity where we could start developing vaccines and developing ways to evaluate the vaccines and work with the virus. So we started making plans, and mid-February I got on a plane, came out here to Saskatoon, where we started developing, again, SARS-CoV-2 vaccines and ways to evaluate those vaccines before anybody, I think, was really aware. I left my family back in Halifax, and I basically never went back. Sold my house, never went back to it. And basically this is the hub in Canada where if there's a Canadian developed vaccine or antiviral, we evaluate it here. And what is striking about that, and what I really want to say, is I'm one of very few researchers with that capacity. So because funding was cut so much and there was so much disinterest for viruses that you couldn't predict, or doing things simple like evaluating a vaccine that's seen as academically boring, but in my mind, very
important,
very much a necessity. So that's where I am today.
You're a prairie girl now.
I'm a prairie girl. My family joined me in August, and I was very lucky to have the holidays and I guess Easter weekend. I was telling Chris it's nice that they're here.
Yeah, and you are working tirelessly, I know, on this vaccination rollout. I'm sure there may be, Chris is managing the questions, so I don't know. I'm sure there will be some questions coming in. But what I would like to do, just given our time, is open up before we start fueling the questions from the guests throughout the panelists. Panelists can all start to unmute, and we can all jump in along the questions. Allison, I'm going to just say this, if you can sum up in an elevator speech, if at all possible, watching from Saskatchewan, how quickly do you think we can get this vaccination thing rolled out here in Canada? I mean, Joe Biden's Instagram looks really, really pretty compared to ours.
Yeah, it's such a hard topic to talk about, considering that we don't have much vaccine capacity here in Canada. Our place in, I guess, the political ladder of the world is not as high as what we wanted. There was a lot of criticism that went towards the government for, I guess, putting ourselves first for vaccines, which I did not see, because knowing that there was going to be vaccine shortages, we were just trying to get whatever we could. So it's an interesting turnaround now that everybody is annoyed we don't have anything, or we don't have enough to cover our population. But also, I'm very, very aware that if there's not enough vaccines here in Canada, there's not enough vaccines in many of the other parts of the world. And something that I think is really important, and I was hoping that as working on Canadian vaccines that we could contribute to other parts of the world. But unfortunately, we don't have the capacity to make them. So it's an awful place to be in.
It is.
But on a positive note, I think that, I'm hopeful that we'll learn from this. And I think there's been investments, and I hope that we have a longer societal memory than from SARS-1.
Absolutely. I see, Chris, I don't know, this came as a direct message to me, so I don't know if you've got the capacity to read all the messages. I only have the one, so I'll read the first one. It's a question for Allison. My 55-year-old husband and I have signed up for various pharmacies for the AstraZeneca vaccine. I'm still waiting to hear, but friends and family keep texting me saying, hey, the pharmacy is taking walk-ins. They have loads of leftovers, call, go. What's your take on that in terms of, it's like, I know you're in Saskatchewan, but that is what's happening here in Toronto. Like Facebook, are you still on Davisville Parents? If you are,
I don't think so.
Get off of it. No, just can get a bit heated over there in Davisville. But like every night, it's like shoppers at Davisville and Young, they've got vaccines. And then we know people that they're like, well, my mother's on a list, and like, why are they calling her? Do you know anything about that process, or is that something that is?
I have no idea, and it's hard to know, and we have a decentralized healthcare system. So that was something that
Indeed.
I was really frustrated with, going out thinking about a vaccine rollout plan. And actually, like, I told CBC, I'm like, we don't have a vaccine rollout plan. So the WHO is talking about this, the US government's talking about it, nothing from Canada. So anyway, unfortunately, I don't know what different communities and what the status is, but
it must be frustrating for you too, to know that, I have actually talked to some pharmacists directly, and they're saying, like, we have like vaccines that are going to expire tomorrow. Like, we need people, we need bodies, and Torontonians, at least, I can't speak for all of Ontario, but Torontonians are like, well, we're not allowed to go yet. Like, don't throw them out.
I think if you have any way of putting yourself on a waiting list, like, that's amazing. And I would totally recommend doing it. I'd put myself on a waiting list if I could.
I've actually been telling people, this is where I'm like, just go, just show up. Like, if the pharmacist who puts the thing on Davisville Parents at 10 o'clock at night says I have 200 doses, and I've got nobody, I'm here until midnight, I usually start sending it out and saying, just go, just show up and ask if you can get it, ask if they will give it to you. And I have the philosophy of the more shots in arms, and I know a lot of people, like, the more we can get, the better. Chris, do you have any more coming in here?
I do.
Okay. You have to unmute yourself though.
Hello, everyone.
That's Chris. His hair isn't quite that.
Oh, wow. Anyway, I do have, there's a couple here that I have. So this is kind of for anyone on the panel who wants to answer this. The first one is, when other people were contacted by public health, did they receive clear guidelines about what isolation means? I don't know if anyone wants to tackle that one, or if they know of anyone who's had their story.
Well, I can jump in on that one. Chris, you got to mute so we don't get as you know, we're in very small space here. Mute there. I muted you. I was contacted by public health 4 days later. I did not receive a clear message about what isolation meant. Luckily, I knew, I'm a bit of a I'm an expert on hygiene and containing my own viral stuff around here. So I knew what to do. But that was what was really tricky. And that's what led to Josh and I having a very passionate conversation, because both of us felt so unbelievably badly about people who just got these phone calls from public health that did not give clear directions about what to do, how to contain the virus, how to take care of their families, how to prevent the illness from spreading within their own apartment or house or community. And we somehow miraculously, nobody in my family got it. Chris did not get it. Luke did not get it. I have no idea how we made that happen, but I'm very proud of ourselves that somehow that worked. Anyway, sorry, is it Parvin? Hi, you have your hand up. So did you want to say? Yeah, go ahead.
That was actually my question. I'm actually Bridget. Parvin is my daughter, but she was the last person on my team. So.
Hi, Bridget.
The other reason why I came up with a filter because my daughter was there. But yeah, I wanted to elaborate hearing your answer that because it happened to me and I was part of an outbreak. And it's one of the things that the person who connected me to this whole meeting had said that it would be good for me to be able to hear everything you guys had to say too, was that it was what you said early on in what you were talking about, the fact that there's an assumption that everybody in the population has the same knowledge base and the same language level and the same understanding. Right. And I was completely my heart broke when I got my letter or my message, my email at 11:30 at night on a Saturday saying, one of our contacts has a positive case. Sit tight, don't do anything, isolate. And to me, that meant, okay, my front door is closed. I'm not going anywhere. And then I went and immediately got tested as soon as I could, got my positive, and then was like, okay. And like Joshna had said, I'm very fortunate. A million things. Amazon boxes just started piling up at my door. There was soup, there was everything. And I understood what I had to do. And then when I started reading the postings that I got from public health that were coming in on my email, and then I went to the website, and when I saw that it said isolation when you have a contact in your house that's positive means that you only leave the house for essential purposes, and work and school are included in essential purposes. And I guess I wanted to bring that further and find out if anybody else had that kind of discovery and aha, and how we, as we're going into this rise right now, can maybe do something to fix that so that other people who don't have the awareness and knowledge that isolation means just stay home at this point. And like you said, Joshna, finding a better way for people like us who are so fortunate that we have loving people around us that bring us what we need. How can we quickly put these networks in place? How can I, now that I'm out, help other people and put soup on other people's doorsteps that I don't know, because I just want, I guess that's my question, is I wanted to find out if other people had seen this big gaping hole, how we can try and fix it, and how we can make sure that, as the risk seems to be really great right now, we figure out how to let everybody know to stay home.
I think that's a great story, and I'm glad that you're well. You're fully recovered, no lasting symptoms? Ish. I know. Ish. I'm glad that you're well and that you got through it and navigated. Joshna, that's probably one for you, or maybe Lesley.
Sure. I also noticed these glaring gaps, right? And I was frustrated at how much conflicting information I read everywhere, between the Health Canada's website versus the City of Toronto's website versus the province of Ontario. I was like, I'm just here, right? And then occasionally I'd go over to see what Johns Hopkins and the Mayo Clinic have to say, just to balance it all out, right? It was like getting quotes for home renovation, right? I'm like, let me look at 5 different options, and then I'll make my decision in between all of that based on my own good sense. But I definitely noticed that. And one of the things that really struck me was that there didn't seem to be any real definitive understanding about when this was done, right? And because they said isolate for 10 days, but I found so much evidence and research that suggests that days 12 to 14 or days 10 to 14 were actually super vulnerable for that sit back, the snap back reinfection that everyone kept talking about, right? So I'm like, why on earth in the most potentially vulnerable moment would I go back out there? This seems
There's
crazy. I decided to self-isolate until day 15.
Yeah,
I was
that
just
was me
like,
too.
this is crazy. I am not putting myself out there. Why would I do that to myself? Why would I do that to other people? Right? This is insane. I've done it. I've been here this long. What's an extra 3 days at this point?
Hey,
right?
we've been here for a year and over a year. What's another, little
precisely. But I have to tell you, I had a hard time figuring out when I was safe to be out in the world. Right, that was really, really tricky for me. And I remember I went to the Fiesta Farms, is my local and favorite grocery store, and at the door they have people there, sort of counting people in and doing surveys about symptoms and whatever. But at this point, when I went in there, he asked if I had any symptoms in the last 20 days.
And you're like,
and
define symptoms.
Technically, I was like, I sure did, because I had COVID in the last, I definitely did. But I realized that at that moment, but for me, technically, this would have been day like 19, 20, right? Since my first my first symptoms showed up. And I knew that if I had told them this, that he would very politely ask me not to go into the store, right? So I said no. And as I was pulling out my buggy to move around, I was like, okay, wait, have you done something unsafe? Have you lied? What has happened here, right? And as I'm in the produce section, I'm like, I definitely lied, but I don't believe that I did anything unsafe.
Well, and that's just it, is that, yeah, you were following public health guidelines. You were told at day 10, you were no longer contagious, even though you still had to stay in your apartment till day 14, but you chose to do that. You could potentially go out.
Right.
That's right. Yeah. It is. There's a lot of misinformation.
It was. And then I thought, okay,
tricky.
So if technically I should not be in this store because of the way I would answer these questions, then when is the time for me to shop? When is right? Because it's not that immunocompromised first thing in the morning. That's not my time. But and then I was like, so is the people who have already had COVID, is our shopping time at the other end of the day? Right, which is sort of a dismal thought in terms of the bakery availability and whatever else is in this store. Like we all get all the crap cakes and no bread and whatever else, right? Worked over produce. But in this spirit, I've really had some solid thoughts about creating how to take care of somebody who's got this going on, right? And I have wanted to, because I have had some residuals with foggy head and fatigue. And I wanted to, I feel like I wanted to extend my time to say, technically I'm not sick, but I could still really use more jars of soup at my door.
Right. Well, right? And I was actually going to, I know we've got a ton of questions coming in, so I want to make sure that we get to all of them. Please. Lesley, I'm going to get you, if you would, to put the People's Pantry information in the chat so that, I'm so sorry. All I could see is Parvin, and I know that's not your name. I'm sorry, I forgot it. Bridget. Sorry, Bridget. I'm going to get Lesley to do that. Lesley, you have your hand up. Do you have a quick something you want to add to that? I just want to make sure that we've got, how many questions do we have, Chris, in the chat? We have about 7 or 8 questions. So Lesley, go ahead.
Yeah, just to be super fast, and Allison, you can speak to this far more than I can. I've been joking all year that there's going to be a lot of dissertations that come out of this year in every single discipline in terms of research. But I think part of the challenge with all of this is that it's all so new, both in terms of the way that this pandemic has swept the planet. And I mean, Allison, you spoke about SARS. Very different in terms of, hospital acquired nosocomial as opposed to community acquired. And it's just the patterns have been so different. And this is so novel, not just in terms of the virus itself, but in terms of the way that it's been experienced globally. And so, part of the struggle, I think, is nobody knows. That just keeps coming up. And Lesley, when you first got sick and called me, you're like, what do I do? I'm like, I can't tell you. Nobody knows. It's sucks and it's scary and it's hard and nobody knows. And so that's, to me, a big reason why there's so much inconsistency in terms of how different nations provide guidelines, how different provinces provide guidelines, how different stores implement those guidelines, why my clinic is exceeding public health guidelines in terms of PPE, just because nobody knows and everybody's terrified. And so there's lots of different interpretations. So I don't know that I would, part of it is misinformation for sure. Part of it is conspiracy. Part of it is, But some of it is just legitimate. We just don't know because we don't have the data. And I think that for me has been a really challenging part of all of this is just the lack of frank data.
Yeah.
I was actually going to make that point that, and I do this all the time. I say, this is an emerging virus. It's brand new to people, which means the virus is changing, adapting to people. And so what we knew about it was nothing last year. And once we gained a bit of information, it might have even changed since then, because the virus is not quite the same, which to me means that a lot of the policy should have been driven by people with expertise in emerging viruses, because you know it's not stable and kind of you can work around that. Unfortunately, again, there's so few of us, especially in Canada, and I don't think that it was really taken seriously by some of the way public health sees it, because they don't deal with emerging viruses. And I say that as respectfully as possible, because of course, they don't have the expertise to deal with it. And this is the greatest public health emergency we've had in 100 years. We have nothing in our again societal memory to really fall back on from the 1918 influenza pandemic that killed between 50 and 100 million people, but no one thinks about that. And we have very different ways of life than we did then. So it's a little bit not comparable, but that's the closest we have to go back to. So I think, yeah, really good point. And unfortunately, that's what we have to deal with.
We are the guinea pigs. I think that's why I put my Instagram picture when I volunteered for the CanCov study. I'm now the guinea pig, and they're learning from our bodies. So it is very complicated, because whenever you ask for why is this happening, there aren't answers, and we'll hopefully figure it out. Chris, over to you for the next one.
Excellent, sounds great. Can Allison comment on the efficacy of each of the vaccines that we have available in Canada, or will have available in Canada?
Sure. So I guess we are lucky to have 4 different approved vaccines right now. We have 2 mRNA-based vaccines, which is the Pfizer mRNA vaccine and the Moderna. And then we have 2 viral vector-based vaccines, which means basically we're teaching our immune system about the SARS-CoV-2 virus by using a non-pathogenic virus as kind of a delivery system. So I explain that as almost like a Trojan horse, so that your immune system can learn about what SARS-CoV-2 looks like without having to fight the actual virus. So both of the mRNA-based vaccines seem to have fabulous effectiveness, between 90 and 95% when we are talking about stopping disease. So we don't really understand right now if when you're vaccinated, if that's going to stop you from being infected with the virus. But people who were vaccinated had a 90 to 95% less reported COVID-19 cases. So they were 95% less likely to develop COVID. So we know that COVID-19 has this spectrum of disease symptoms, which can be even asymptomatic or mildly symptomatic to very severe, and unfortunately could lead to death. So I think taking that into consideration, it's really important, even though you're vaccinated, to know that you're less likely to develop severe disease, but we don't understand enough about infection. Looking at the other 2 vaccines, the Johnson & Johnson, which we don't have out yet, was put out as a 1-shot vaccine, and has about a 60% effectiveness. The AstraZeneca, looking at what they've reported in their phase 3 studies, was around between 60 and 70, but the real world data looks a lot more compelling, you know, up to 90%. But really what I want to go back to is that, you know, even though these were large phase 3 clinical trials, which has, you know, tens of thousands of people in it, looking at real world data and how we have less COVID-19 hospitalizations and disease, that's what's really going to be important in getting vaccines and having them actually stop the pandemic. So try not to get too hung up on the numbers. If the vaccines have been approved and they're approved for you, then it's really important to consider getting them because you'll be protected from that severe disease.
Okay, thank you. That was a good one. I'm going to turn over to Chris again.
Excellent, thank you. So question, if a person contracted SARS in 2003, would they have immunity to COVID-19?
That's probably for you, Allison. And Chris, you people get to see you now in real time. That's a good looking farmer's market you got there. Over to you, Allison. That's probably for you.
So I don't know enough about people who have been infected with SARS and them getting reinfected, but there is evidence that you still have antibodies to the first SARS virus. So a couple of studies have looked at if these people who are infected and recovered from SARS, and I really want to go back to SARS-1 being having a lot higher case fatality rates. So you were more likely to die. So these people who did survive, you know, perhaps there was something about their immune system that was quite robust and they were able to develop a protective response. They do have cross-reactive antibodies. Are they able to be reinfected? I don't know if we have enough people to conduct that experiment. Right now, in the lab, I don't work with SARS-1 because we don't want to be taking it out and dealing with something that isn't as much of a threat. But again, the cross-reactive antibodies would possibly suggest protection, but I don't quite know.
Sorry, I'm muted there. Thank you for that. There a question that came in here. Oh, a personal question, Allison. How are you doing? Do you have any downtime? Do you feel that you can clock out at all during this time and just kind of, or is it a constant, I'm on?
I really appreciate that question. So thank you for asking. I'm doing well now that my family's here. It was a little like, and I'll be honest, the beginning of the pandemic, so not even when it was a pandemic. Last January, when they shut down certain regions of China, it was a real holy crap moment because I knew what was coming, and it was awful knowing that it was like I had a horrible secret, and you don't want to cause anxiety or scare people. So I think I had a couple of light Facebook posts gently asking people to get some extra food and make sure they had their medicine. And some people laughed and said, I'll make sure to go to the liquor store. When I'd go to my kids' soccer games, it would be in this giant arena, and I'd look around, and this is February, thinking, we're not going to be able to do this. People can't do this in China right now. In Europe, a month from now, we're going to see a different world. And it was awful to be sitting next to other parents, and they didn't understand that. rightfully so, because that's just my expertise. So I think with that, like that was really, really scary and a lot of anxiety, and but motivating for me to do my job. So I was lucky to channel that, and then lucky again to have now my family here. So yeah, there was a couple moments, I think the first half of last year, to where I would just cry thinking about people were dying from this virus and how could I stop this. And yeah, I'm glad that we're seeing the other side, but I hope that we can contain the cases a bit better in Canada. If we could do that, I'd be even better.
Me too, my friend.
Who wouldn't?
Sorry, I just want to say, you got to mute Chris when I talk, just because there's such bad reverb. Allison, what an incredible, I'm going to turn it back over to the questions, but what an incredible burden. Like, just when you were saying that, my heart was just aching for you to just, because you're right, none of us were like, it was February, we were, oh, you know, it's going to be okay. Like, it's not going to come here. It's fine. And for you to know that, and what a burden for you, and thank you for all that you do. All right.
Okay, here we go. We have everything that you are all talking about is very important. Thank you for that. Top of mind for me, long-term, is how to change the terrain of the human body. Example, improve the immune system to be able to better resist and combat viruses and bacteria. How to change and overhaul the food system so that the fresh food, wholesome meals are seen as attractive and affordable rather than sugar and processed, poorly nutritious foods rather than sugar processed. This speaks to the major systemic issues. Does anyone want to chime in on that one?
That's a big one. I'm going to break it into two sections, I think. I also just want to, just before I turn it over to the panelists, keep note of the time. It is 10 after 8. I think we sort of loosely said we were going to stop around 8. We're happy to keep going. If people need to drop off, you won't offend us, and we will have this recorded if you want to see additional information or get in touch. So feel free to do that. But we will try to wrap it up right at a hard stop at 8:30 to be respectful of everybody's time. On that note, Lesley, why don't you briefly take on the first portion, maybe about the immune system, and then you can segue it into Joshna for the food systems, the two of you, in a couple of minutes.
Sure. I'm not sure I can just do one, but I'll keep it as concise as I can. So the way I think about optimizing the immune system and the terrain, it's a great word. I'm curious who asked it. The idea of terrain theory is this sort of idea of creating a condition in the body that allows the body to fulfill its potential, essentially. And I would argue that same idea applies to the planet. That, you know, if we don't give the planet the sort of things that it expects, you know, in terms of natural laws, then it's not going to be in a healthy balance. And so that's the idea of terrain theory. And so the idea is not in direct contrast to germ theory, which is this idea that there are infectious agents that stimulate our immune response and can make us sick and so on. But this idea of the balance that as we know, people are more resilient to infection depending on the nature of the virus and, you know, virulence of the virus, but also the health of the person and the other determinants of health. So as was pointed out, the nutrition, levels of stress impairs the way the immune system responds. Access to a natural environment changes the way our immune system responds. The amount of physical activity, too much or too little, changes the way our immune system responds. Whether we get enough sleep and good enough quality of sleep, all of those things, I call them the pillars of health. So to me, it's stress level, it's sleep, it's food, it's movement, and it's time in nature. And those things are complex, of course. And the question was, you know, socially, you know, there's lots around social behavior theory in terms of why people engage in certain behaviors. As I pointed out at the very beginning, it's not about putting the burden of that on the individual. That's part of it. Individual choices are part of that. But that sits within a nest of, as I was saying earlier, social, economic, ecologic context, and our structures, our healthcare systems, our food systems, you know, food supply chain, all of those sorts of things. So the way I think about optimizing the immune system is that if we can optimize all of those pillars of health as best we can, then the immune system is going to work as best as it's capable of doing. And certainly there are herbs and medications and so on that can help with that. But ultimately, if we're going to improve the terrain, since that was the word that was used, we have to make sure we give the body all the things that it expects, the things that our DNA expect in terms of good health. And that's not a high sugar, high fat, high processed food diet. That's not a built environment like the one I'm sitting in right now. That's not separating us from the soil and separating us from the trees. That's not eating food that comes from the tropics and has been traveling for days or weeks. So none of those things are optimal. It's amazing to me when people come in and say, oh, I'm run down and I'm tired and I'm sick all the time. And I'm like, well, how much sleep do you get? And they're like, oh, 5 hours. Well, that's not enough. I can solve your problem right here. But there are lots of barriers to doing that. So then to me, that speaks to the bigger structures. What are those barriers and how can we influence them? And I'm going to say something that's highly unpopular, and Lesley, you know you have the power of mute. But to me, the fact that we've commodified all of those things is deeply problematic. So the whole premise of the food system, the premise that food is a commodity that people need to buy, as opposed to a natural resource over which they have sovereignty and power and agency, is a big part of that. The fact that people must get up and go to work and separate themselves from their communities and their families in order to put that food on their table, in order to purchase that. The fact that our water supply has been commodified and exploited. The fact that people have been commodified and exploited throughout history and across the globe is the source, is the deep roots of this problem. And to just put a finer point on it, it's capitalism. And our obsession with GDP and infinite growth on a finite planet is the source of the problem. And so we have to change that. And I know that that sounds like a massive problem, and it is. But ultimately, that's rooted in our values. So if we as a community, like the work that Lesley and Chris do with Daily Apple, the community food groups, you know, the Stop is an awesome example. How do we build a collective of people who not only create alternative structures, giving food to people who need food, but also develop the values so that we can shift the policies towards measuring health and well-being of people on the planet and not GDP.
So I was going to just say, Lesley, you just basically inadvertently did a business plug for me, which is fabulous. Considering I've been out of work for over a year, come to our farmers markets. I will teach you aerobics, which will get you in fabulous shape so you'll be perfectly healthy. And we teach workshops on how to grow your own food in our community garden. So we're all good. No, excellent. Thank you. And you know what? I keep it light. That's my job as the moderator, but Lesley has amazing points here. We could have a whole next part 2 on this symposium. I think, Joshna, in the interest of time, do you have any additional points that you wanted to add into that? Because I know you're the other expert on this. I'm gonna keep you tight to sort of like a
totally.
1 to 2 minutes.
Lesley, I'm with you with that revolution. I believe that is exactly the root issue of this problem, and I will be behind you with my fist in the air. But one of the piece that I want to add in here is just the fact that this is the time for us to really walk our talk on these ideas about access to good food being a basic human right, and for us to actually consider healthcare that is preventative, right? And to really, like, one of the things that I scream about is the fact that we can only be so proud of our technological advancements and innovations and whatever when we haven't actually figured out how to make sure everybody goes to sleep with some food in their belly on this planet. Like, we should be more ashamed of that than we are, right? It is a much darker stain on our civilization than we all are understanding. And so I really hope, and part of the work that I'm doing is to really consider how we rebuild our food system, right? We've seen poverty is a determinant of health, and those living in poverty were disproportionately impacted by this virus. And largely that has to do with the fact that they are not eating great food, right? They don't have the money to buy it. They don't have the skills to cook it. Like, it's all of those food security basics. And so I'm of the belief that if you reorient the food and if you build the food systems well, the impacts will actually just start happening, right? Just focus on food and other things will grow.
With the knowledge and the skill set of this panel alone, I mean, we could just really start our own little commune.
We need a check and an office, and we are really ready to take this
on. And Chris is a musician, and he can be the entertainment as well. So we've got, arts and culture in that mix too. Chris, next question.
So is Joshua. So we're all good, and Lesley. You can sing, Solomon, you're amazing. Okay, so here we go. We have a question. Oh, for anyone who actually did, and this is anyone who's listening as well and watching. When you did get the virus, did you get the number to put on the app to alert everyone that you might have been in contact with?
I'm going to jump on that one. So yes, so we did. So here's the crazy thing. And this is, my husband was in my house and his alert did not go off. His alert did not go off once, never. And he'd been with me, my father, a lot of people who are here personally who know that my mother died, not of COVID, but during the pandemic. So my father has bubbled with us as he's now alone. He had driven me to my hospital appointment where I obviously either got infected or I had already previously been infected because 12 hours later I was violently ill. His alert did not go off. Yet my sister's husband's alert goes off constantly, and he has not left his third floor in months. He works, he's a lawyer, he works around the clock, and his alert keeps going off. And he hasn't seen anybody other than his wife and his 2 children who have not been in contact with anybody. So there's an answer to your question. I don't know if anybody else wants to jump in on any more on that, but I don't think 100% it's working. I'm not saying that to say don't use it, like take it seriously. If your alert does go off, take it seriously, but seems to be a bit tricky.
It is a flawed system. I could never get the app to load properly on my phone. And I even went and got a new phone in the middle of it all. But it is not, I got the number, but it just, unfortunately, the technology did not work. So that, yes, the number was received, but I couldn't actually do anything with it.
And the other thing too that bugged me a lot, and Bridget, I see that you've got a hand up, that really bugged me a lot about that too, is it goes back to our conversation about social inequality, and you had to have a certain level of phone to be able to download that app. I mean, just even talking to my friend who's a kindergarten teacher today, and at 2:45 when they said school's canceled, you got 15 minutes to get your kids out of here and they need technology for tomorrow, and they don't have enough technology for every student. I mean, not everybody has a phone that has that high grade of an operating system that you could download the app. So flawed system. Bridget, quick
yeah, I was just
this?
gonna say the same thing. I ran into problems with it too. I have a split residence and I have a secondary residence in Toronto. And I think you mentioned you're in a condo too, and a high-rise situation. I was never able to even use the app anyways, because for anybody who's in like structures like that, it's like ping, 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 ping. And I have an elderly father who has the app on his phone, and he works at Western University, and it hasn't gone off at all. So, and if everybody's heard what's going on at Western, it should have pinged. But yeah, we found the same thing for us.
Thank you for that. Thank you. Chris, any more questions in there?
What percentage of the population needs to be vaccinated to really get this under control?
I would say, Allison, that's probably for you.
That's probably for you, Allison.
Yeah, so good question. And right now it's an estimate between 80 and 95%. So, if we're looking at really wanting to get rid of the virus and eradicate it, we really need as many people to be vaccinated as possible. And just that when we talk about herd immunity, that really just pertains to being vaccinated, because infected, as Lesley mentioned many times, what the virus is doing leads to these prolonged symptoms, and really we don't know how well your immune system is at protecting you from a possible secondary infection. So, but we know that the vaccine leads to robust immunity, so something just to consider.
Thank you. And I was going to ask, look, I just had brain fog. So this is what happens post-COVID. You have a question, you're like, what was I going to say? Anyway, I'll stop talking. It'll come back to me.
So there's one here to follow up on that is there are lots of conflicting reports on the vaccine efficacy after 1 dose versus 2. How safe are my parents after 1 dose of Pfizer? Should we continue to keep our children away from them?
Yeah, another super great question. And being a vaccinologist, so I didn't go into much of my background on vaccine evaluation and design, but it's something that we've known for a long time that, you know, you have the best protection from a vaccine after you've had a prime boost or a first and second dose. But your boost works better if there's a large amount of time in between the prime and the boost. So I wanted to mention that if Canada's gone with this delayed dosing, they're not compromising that you will get that really nice boost with your second dose. What we don't know as much is that middle ground in between the first and second dose, which I think really reflects back on the question. But what it looks like is certain age groups have a really robust response and most likely are well protected after that first vaccine. But again, you're not fully vaccinated until you get the second dose. For other age groups and people who are immunocompromised, the data that's coming in right now, and of course, people always say in real time, but that's the way I'm looking at it too. I get to see preprints of papers and studies where they're not completely finished yet, but it looks like these older people and immunocompromised people don't really get that nice, robust response until that second dose. So if you are a person in an older age group or immunocompromised, you really still wanting to be watching yourself and keeping that social distancing and following the public health guidelines. So a really, really good question, and hopefully that provides some clarity, but.
Thank you. Chris, any more? That's it. I think we've run through all the questions, so that's wonderful. I said I would get you out by 8:30, and I'm 6 minutes away from that. They were great questions, guys. I mean, this can go in so many other directions too. This can have spin-off symposiums. I think there's so many different seeds that have been planted from this conversation. I want to take just a few moments just to check in with the panelists. Any last remarks from any of you guys? You're also incredibly brilliant and amazing. I sit here and I'm like, I think I have to start doing more crosswords. You have such a wealth of knowledge, and gosh, if I can ever share some of my aerobics knowledge with you, I'm happy to do that. I want to thank you for taking so much time and energy and passion to have this conversation with me. Do you guys have anything else you want to say before I bid everyone farewell? You can unmute.
Honestly, I hope everyone is well and continues to be well. So it's really important to me and why I do my work, because it breaks my heart to see the virus causing such destruction. So
thank you,
Allison. And can I say, we are here having crossed a 1-year anniversary on this thing. I really feel like we all just need to settle into the fact that we are not okay, right? Even if we haven't gotten sick, right? Even if you haven't lost anybody, if you haven't, even if that hasn't happened, it's totally okay that you are not okay, right? Witnessing this, living through this is no joke, right? I just had just the other day, I had this random cry in exasperation just considering it all, right? I think I saw enough faces of medical professional with the lines from the masks on their face, you know what I mean? That sort of worn out look with the head in hands in a peaceful moment. And I was like, what have you all been through, right? Yeah. What have you all been through watching this happen, not knowing how safe you, it's crazy. So please, everyone, just go easy on yourself. And if you're able, cook yourself something nice to eat. Take good care of yourselves, everyone.
And to add to that, take care of each other, and please also don't let up. If you, I mean, in terms of advocacy and activism, obviously we need to take care of ourselves and check our own capacity and sustainability in that work. But you know, if you see something, if you see an injustice, if you have thoughts about structures and systems that need to change, then please make your voice heard. I mean, Josh is off the call. Poor Josh gets harassed by me all the time. Not because I think he's doing anything wrong, but it's important that he has my voice and all of the voices of the folks in his ward behind him, so that he knows what his constituency are expecting and demanding. And so the same is true of all of our levels of government. And make your voice heard and speak out. And that can be done through political engagement, like I'm talking, but it can also be done through direct action. And if anybody wants any, you know, thoughts about what that looks like in a non-violent sort of way, you know, let me know, because there's all sorts of ways that we can work together to shift the underlying cause of all of this.
As you know, Lesley, I call you the pretty protester. So absolutely, I can connect any of you guys with our wonderful panel. And on that note, I want to end. I promised I wouldn't get teary, so I will not. I'll cry later. This year has changed me unbelievably. We have had more trauma than I know what to do with. I won't go into all the specifics, but catching somehow the coronavirus and developing COVID-19 and now being diagnosed with long haul syndrome has been more than I could have ever imagined would have happened in a year. And I am determined to make something positive come out of this. I am fortunate that with my job, my chosen career, aerobics instructor aside, my husband and I run the Apple Tree Group, which is a nonprofit. We have a dedicated space in Midtown Toronto, and we are going to regrow TO. We are going to do all of these wonderful things and have Joshna and Lesley and Allison from afar, and we are going to educate people with free workshops and places for people to come together and reintegrate and reconnect and rebuild. That is my promise to you. I will continue to work on it so that we can all process this unprecedented year. Thanks for joining us. Thank you to Chris, my silent partner over there who does all the tech. Chris is not a tech guy by trade, so well done you. I wouldn't know how to do any of this without you. And please stay in touch. You can get in touch with me on any of our social media channels or through me, my email directly, and we're happy to answer any further questions as they come in. I'll make sure that they get to our panelists. Have a great night, everybody. Bye.